Hello to all of you today. We will tell you what toxoplasmosis is. Let's start. Toxoplasma, an infection caused by a parasite called Toxoplasma gondii, is a contagious disease that usually affects pregnant women and people with weakened immune systems and is transmitted to humans through cat feces and contaminated food. Toxoplasma, which shows flu-like symptoms such as fever, headache, swollen lymph nodes, and fatigue, is usually treated with medication. What is toxoplasma? Toxoplasma is a parasitic infection caused by a single-celled parasite called Toxoplasma gondii, transmitted through undercooked infected meat or infected cat feces. The parasite, which can be passed to the baby during pregnancy, usually does not show any symptoms, but some infected people may experience symptoms such as fever, fatigue, muscle pain, swollen lymph nodes. Complications can develop, which can be particularly risky for pregnant women and people with weakened immune systems. Early diagnosis and treatment can reduce the risk of complications and alleviate the effects of the disease. What is congenital toxoplasmosis? During pregnancy, there are some issues that need to be careful in terms of health. One of these is congenital toxoplasmosis. This condition, which damages the baby as a result of the mother-to-be being infected with the parasite called Toxoplasma gondii during pregnancy, can lead to serious consequences, because Toxoplasma parasite can cause damage to the baby's brain, eyes, and other vital organs. What are the causes of toxoplasma? Toxoplasma disease is caused by a parasite called Toxoplasma gondii. This parasite is usually found in the intestines of cats and is excreted through feces. Toxoplasma, which is more common in people in close contact with cat feces or cats, is also transmitted to humans through contaminated food or contaminated water. On the other hand, it is more likely to be transmitted from cats that hunt or consume raw meat. It can also be on the surface of fruit and vegetables. How is toxoplasma transmitted? Toxoplasma, a disease caused by a parasite called Toxoplasma gondii, is usually found in the intestines of cats and is transmitted to humans as a result of the spread of this parasite from the body to the environment. Humans can pick up the parasite when cleaning cat litter or by contact with soil. The transmission routes of toxoplasma, especially cat feces, are as follows. Cat feces. It usually lives in the intestines of cats, and infected cats can spread the parasite into the environment through their feces. People can become infected when they come into contact with these feces when cleaning infected cat litter or handling soil. It is therefore important to wear gloves and wash hands thoroughly when cleaning cat litter. Poorly cooked or raw meat. Consumption of poorly cooked or raw meat can lead to transmission of the Gondii parasite to humans. It is therefore important to minimize this risk by cooking meat well. Contaminated water and contaminated food. The parasite can be transmitted to fruit and vegetables through contaminated water. It is therefore important to wash such food well. Contact. It can be transmitted to humans through contact with infected animals, especially those who work in occupations that require frequent contact with animals, such as farm work, are at risk. Congenital transmission. Toxoplasma can be passed to the baby during pregnancy. What are the symptoms of toxoplasma? Symptoms of toxoplasma are often similar to flu symptoms, and the most common symptoms are fever, body aches, swollen lymph nodes, headache, and fatigue. Symptoms of toxoplasma with flu-like symptoms include fever, swelling of the lymph nodes, body pain, headache, weakness, and fatigue, skin rash, pain in the eyes, blurred vision problem, blurred consciousness, enlargement of the liver and spleen, seizures, jaundice, infection in the eyes. In more severe cases of toxoplasmosis, eye infection and discomfort can lead to blindness, but it is not certain that this will occur in all toxoplasmosis patients. Fever and malaise. Symptoms of infection include fever and malaise. These symptoms are usually mild in people with a strong immune system. Swelling of the lymph node. Swollen lymph nodes are common in infected people. Swollen lymph nodes are usually felt in the neck, armpit, or groin areas. Muscle and joint pain. The infection can cause muscle and joint pain. These symptoms can occur especially if the infection is spread. Who are the risk groups for toxoplasmosis? The risk of developing toxoplasmosis is higher for certain groups. Risk of toxoplasmosis in pregnant women. During pregnancy, toxoplasma can be passed from mother to fetus. Pregnant women should therefore be particularly careful. People with a weak immune system. People with a weakened immune system, HIV positive people or those taking immunosuppressive drugs, are more vulnerable to toxoplasma. Other risk factors. The risk of toxoplasma infection may increase, especially in households with free-roaming cats. Toxoplasma gondii can be transmitted to humans through contaminated water or food. Consumption of poorly cooked or unhygienic food may increase the risk of infection. What are the methods of diagnosis and diagnosis of toxoplasma? Toxoplasma infection is usually diagnosed by laboratory tests, but in some cases, radiological examinations can also be used. Laboratory tests, blood test. The blood test looks for toxoplasma antibodies in the blood. These antibodies are called IgM and IgG antibodies. These values indicate whether infection is present or not. Amniocentesis. If there is a risk during pregnancy, the test is performed and anti-toxoplasma should be investigated. This test shows whether the baby is infected or not. Biopsy. People with a weak immune system may develop lesions in their organs due to infection. The lesions are examined by biopsy and the presence of the parasite is checked. Fecal sample. In this rarely used method, it is checked whether the parasite is in the feces. However, this method is not used alone, but in addition to other tests, because it is not sufficient to make a diagnosis alone. Radiological examinations, imaging. If your doctor suspects that you have a brain infection, he or she may want to perform an MRI scan. In this way, a detailed image of your brain is obtained and evaluated by the doctor. What are the treatment methods for toxoplasmosis? Treatment methods should be applied for those who are toxoplasma positive. Although there is no toxoplasma vaccine, there is only drug treatment. Treatment of toxoplasma infection can generally vary depending on the patient's immune status, age, and severity of the infection. Drug treatment, primetamine, a drug often used in the treatment of toxoplasma infection. It inhibits the growth of the parasite and stops it from multiplying. It is often used together with the antibiotic sulfadiazine. Sulfadiazine, an antibiotic used to treat toxoplasma infection. It is more effective when used together with primetamine. Precautions to be taken during treatment. It is important to take medicines regularly and as prescribed by your doctor. It is important to report side effects and continue treatment according to the doctor's recommendations. Food safety must be observed as the infection may recur. People with a weak immune system should be careful during treatment and try to protect themselves from infection. Alternative and supportive therapies. Alternative or supportive therapies can sometimes be used to treat toxoplasma infection. These include dietary adjustments, supplements to boost the immune system, and medication to help manage symptoms. Does toxoplasmosis go away completely? In many people, toxoplasmosis resolves spontaneously and symptoms disappear. However, in some cases, the infection cannot be completely eliminated from the body. And once infected, it can become persistent in the body. Many people with a healthy immune system can be carriers without symptoms. However, in people with weakened immune systems or pregnant women, this infection can lead to more serious complications. How can toxoplasmosis be prevented? To avoid getting toxoplasmosis, you need to be careful and take some precautions. Hygiene and cleanliness. Frequent hand washing with soap and water prevents the spread of pathogens. Nutrition and food safety. Thorough cooking of meats reduces potential toxoplasma contamination. Thorough cooking of meats such as red meat and chicken is particularly important. The pathogen can be transferred to the surface of fruit and vegetables through contact with contaminated water or soil. It is therefore important to wash fruit and vegetables thoroughly. Be careful in contact with animals. In particular, you should avoid contact with cat feces and use gloves if you have to handle cats. Frequently asked questions about toxoplasma. What happens if a toxoplasma infection is passed to the baby? If the mother passes toxoplasma to the baby, the fetus is at risk. This can lead to congenital abnormalities and various health problems. Early diagnosis and treatment are important. What is the importance of infection during pregnancy? Toxoplasma infection during pregnancy can cause serious complications for the fetus. Early diagnosis and treatment can reduce the risks. Is diagnosis possible for the fetus during pregnancy? Yes, it is possible to screen the fetus for toxoplasma during pregnancy. This can help assess whether the mother is infected and whether the fetus is at risk. How is toxoplasma transmitted? Toxoplasma can be transmitted through contact with feces of infected animals, consumption of contaminated water or food. There is also a risk of transmission when using cat litter. What does Toxoplasma IgM negative mean? A Toxoplasma IgM negative result usually indicates that there is no active infection. How is the Toxoplasma test done? The Toxoplasma test is usually done with blood samples. They diagnose the infection by looking for the presence of relevant antibodies or DNA. What does Toxoplasma IgG negative mean? A negative Toxoplasma IgG result may indicate that the person has not been vaccinated against Toxoplasma or has not been previously exposed. Thank you for watching.